Support, I am Dr. Momo Shulchudri, MSCOO7 version. Welcome to Entertainment Science class. Those are my patent formation. Twinkle twinkle little salam. Shakaloke Sustala Shabada Allah. Yashapialam Yallah, Shapialam Laziallah, Shapilam of Allah. I am a simple creation of Allah, nothing else. Ya Alif Lam Lam. Yallah, Shapialam of Allah. Twinkle twinkle little salam for my personal patient. Then that is command system, you know that. I give the command my creation element, soil, dot, soil thinking can do that. For my patient, for personal patient, that is general patient. Twinkle twinkle little salam, shakaloke sustala shabada tari, shapialam redi shapialam la shapialam apilla. Ya alif lam la shapialam apilla. By the help of constant multiple graceful science to one and only tutorial. Now we go to the lecture. You know that we, as a medical science, we know that the shock. So for my friend, for my patient, how you know you develop shock? Like neurogenic, septic, anaphylactic, hypovolemic, cardiogenic. You see the pulse rate normal for patient, body or tachycardia or not, breath rate reduce 10, less than 10, above 24 or not. You will not take risks above 20 or not. Also cold clammy skin, first sweating, then cold clammy, when tachycardia, sweating, when bradycardia, clam and cold. Fine. Symptom of shock. Then in case of neurogenic shock, you feel pain. Cardiogenic shock, you feel also chest pain. Neurogenic pain, you headache. And hypovolemic, in case of neurogenic, cardiogenic, septic shock, you feel fever, shivering, and anaphylactic shock, you feel itching. Hypovolemic shock, you remain dehydration. For my patient, then go to the say one and only creator name. What you say? Allah, God, Ishwar, Bhagavan. Then go to the doctor, and doctor give the treatment. Understand? Those are my patients. You can understand. And in case of doctor first sees the breath rate, pulse rate, oxygen per minute, then pulse oximeter, see the pulse oximeter. The ECG show what is the ECG and what is the pulse rate, what is the oxygen saturation. Doctor. Then they see the bowel movement, also urination, stool, vital sign. Check the vital sign, also stool coming. Then you go to the treatment protocol, routine investigation, then go to the treatment protocol. Those are doctor. Without routine investigation, you can understand that. Equal more or less 80% on general, 80% patient can be, you can identify by routine investigation. Understand? On general, 80% diseases. 80% equal more or less 80% disease is identified by routine investigation. So give the routine investigation. Okay? Those are doctor. And now we discuss about one disease in case of diarrhea. What is diarrhea? Passing of more the stool, what passing per day, one time or two times. If eat more than 3 times per day, that is diarrhea, and continuous there is diarrhea. And in case of diarrhea, patient uses the first virus, bacteria. In case of virus, rotavirus. You know that this rotavirus is for children, not for adults. Adult may be, but rare. That is affected by children, rotavirus. And what is bacterial expression? Salmonella, Shigella, Vibrio coli. In case of Salmonella, Shigella, Vibrio coli diarrhea, you know that bacillary dysentery. In case of that, you know that the bacillary dysentery come bacillary dysentery. If bacillary dysentery occur, you know that. And how patient identify the passing of blood in you. Without you feel remain good, but when diarrhea occur, passing the blood with stool. Then you identify this is dysentery. In case of bacillary dysentery, blood come and stool come. In case of amoebic dysentery, you know that there is a different stool, there is a slippery thing in your stool remain in amoebic dysentery. In case of amoebic dysentery, drug is the choice of the drug metronidazole. In case of bacillary dysentery, you found drug is the choice ciprofloxacin. Fine. In case of ciprofloxacin, DNA gyrase, plasmid. In case of bacterial DNA inhibitor. So amoebic dysentery, drug of choice metronidazole, slippery stool. Also the abdominal pain. You see the diarrhea. How you see the diarrhea? Treatment of the diarrhea, management of the diarrhea. You know that. See the vital sign. Pulse rate. Every disease common factor is the pulse rate, oxygen rate, oxygen. Cause every stage of the disease, cardiorespiratory failure. At the end of the stage, cardiorespiratory failure and patient will die. So see the pulse, oxygen rate, breath per minute, pulse per minute, then abdominal sound. In case of diarrhea, abdominal bowel sound increase or decrease, passing of stool how much time, and every passing of stool give normal saline. তারপরে হলো গিয়া gradation, hypovolemic, you see the pain. Hypovolemic, in case of diarrhea, hot shock develop, hypovolemic shock develop or not, sign symptom of shock. If hypovolemic shock develop, you treat by give the, in case of cholera or the recently, you know the normal saline. In case of cholera saline. Fine. So my friend, I want you understand that. And this virus bacteria, in case of female patient, those are rotavirus. In case of rotavirus, you know that what is the treatment of choice? Sedent, normal saline, and develop shock or not. See the patient, children develop shock or not, then give normal saline. In case of Vibrio cholera, and you stool culture, do the stool culture, Salmonella, Shigella or Vibrio culture. If Salmonella, Shigella, give the antibiotic. If rotavirus, if you give the antibiotic, is what? In case of children, antibiotic is amoxicillin. Amoxicillin is the antibiotic, the choice. But if not work properly, then you go to the ciprofloxacin. But first try amoxicillin in case of children. Fine. So my friend supporter, that is the drug, diarrhea, amoxicillin. And in case of rotavirus, what is the treatment? What is the normal saline? But in case of rotavirus, if you give antibiotic, this is not drug this is the viral disease, viral diarrhea. In case of viral diarrhea, you give the antiviral, not antibiotic, antiviral. So my friend supporter, today engineering is enough from medical science lecture. How to diarrhea management. In case of diarrhea, hot shock develop, hypovolemic shock, correct the hypovolemic. Thank you very much. From today we discuss about diarrhea. From those are the doctor for them, and also my patient.